from the News Channel 5 network. This is Titans Tuesday.
We also have Dr. Ed Glenn. He is from the Tennessee Orthopedic Alliance. He is here tonight on behalf of Baptist and St. Thomas Hospitals. We'll be talking to him about the current injuries, and there really aren't any on the Titans team right now to speak of, other than the normal bumps and bruises. Of course, you and I don't know anything about the normal bumps and bruises that happen on a Sunday afternoon in the National Football League, but this guy has a pretty good idea. He is a Clemson graduate. He played tight end for those Clemson Tigers. How about that? And well, you can't see it on television, but he's a pretty big guy, and so he knows what he's talking about when he talks about football. And of course, he is an orthopedic surgeon. That's why not our camera and say hello to the good doctor. Ed, good to have you here, sir.
Thank you very much.
Got a nice, strong grip. You played what now?
I played tight end at Clemson University.
And what is your claim to fame while you played at Clemson? How many touchdowns did you catch? How many yards did you gain? Do we want to talk about it?
Now you're embarrassing me. No.
No.
We were mainly we were an option team back in the early 90s.
I knew you'd say that. There you go.
I was more of a tight tackle than a tight end.
Okay.
So I blocked most of the time, but I started my last 2 years. Caught 7 balls. They threw 7 at me. I caught all 7. So I'm 7 for 7, but not much to brag about.
That's a pretty good record. That's a pretty good record. Now, back in those days, you didn't go both ways, did you?
No. I don't go back that far.
You don't go back that far. I didn't think so. Anyway, happy to have you here. You are, of course, an orthopedic surgeon, and you are with the Tennessee Orthopedic Alliance, and of course, you're here brought to us by Baptist Sports Medicine. You're part of all of that.
Yes, sir.
So, all right, let's see. You were in the office today, right?
Yes, sir, I was.
What kind of injuries do you see today?
Rotator cuff tears, meniscus tears.
Just the routine kind of stuff that an orthopedic surgeon sees, right?
No, you see a lot more. More commonly, you just see knee pain, shoulder pain, and they really just have a little bit of inflammation. But you know, the good stuff is you know the young, healthy patients who have something that typically you can treat either operatively or non-operatively and make them well.
Well, okay, that brings up an interesting point. How many people do you see who come in with these types of things that you just talked about a moment ago that you don't cut on?
I'd say the vast majority, actually.
You do. You have to, right?
The vast majority of patients that come in to see you, typically, even if it eventually requires surgical intervention, oftentimes you can at least initially treat conservatively, and the vast majority of those patients will get better. Sometimes if they do fail conservative treatment, you've exhausted all conservative measures, then you really don't have a choice. Now, there are some injuries that you don't treat conservatively, such as an ACL tear or a rotator cuff tear in a young person, and those things, you know, you just have to fix, and there's no reason to wait. But the vast majority of people that you do see, you can treat conservatively, at least initially. You are the team physician for Innsworth High School? That is correct. Is that a nice experience? It's a great experience. I've had a lot of fun doing that. It's a great experience to go out on Friday nights and cover high school football. Brings back a lot of memories. And Coach Ricky Bowers is out there, and Megan Mitchell, the trainer. They treat me very well, treat me with a lot of respect, and I really have a great time. So you know what all of these kids are going through when they come up and they got a pain, they got an injury. You're pretty well familiar with all of it because you've been there, and you know how to relate to them, and that is important, I would think. Yeah, I think that is one of the things that maybe separates me from most physicians is that with my background, I think people are more likely to believe what I tell them, and I think at least initially, just from the background, I think it earns a little bit of respect, and that they may take me a little bit more, seriously. Yeah. What kind of injuries did you have in high school and/or college? Broken forearm, partial forearm. Yep. Pretty nasty. Not bad. I mean, it didn't need surgery. Fortunately, didn't go through the skin, and it just got set and put in a cast. All right. And partial tear of my calf muscle. Wow. So that does sound painful. Well, yeah, it was pretty uncomfortable for a while. Yeah. But do you sew that together, or what do you do? No, actually, with a partial tear, you just put it in a splint and then a cast. Once the swelling goes down, you just let it heal on its own. So fortunately, knock on wood, I didn't have any injuries that required any kind of surgical intervention during my playing days. Do we see a difference from high school injuries to college injuries for the most part, or are they all pretty much the same? No, they're pretty similar. I mean, it's still the same mechanisms, and football is still going to be football. It's at a much higher level at the collegiate level, but I would say that probably the injuries are going to occur the same no matter what the level.
And the impact at the National Football League level is just awesome.
Yeah, it's definitely a step above.
And that's why these guys have to be in such prime shape, primo shape.
Exactly. I mean, it's 365 days a year for those guys. It's a full-time job, even in the off season, just maintaining your health and keeping your fitness level at a level where you can hopefully minimize injuries during the season.
It would not be a good thing, Doctor, I wouldn't suspect, for a high school, college, or anybody to sustain an injury and not tell somebody.
I would agree with that. Yeah, I think it's very important if you do have an injury to either talk to your trainer, talk to the team physician, let somebody that is responsible for the health care of that team know, so that they can address it in a timely fashion and hopefully prevent either a new injury or worsening of that present injury.
Yeah, because you could just further damage whatever it may be. You may not think it's too much, but you should always tell somebody. When I played high school football, one of the first things that they told us was, if you get a coach says, look, if you break your arm, that's one thing. If you have a scratch on your finger, I want to know about that, because you could get infection from that. I mean, there are a lot of things that can happen, so nothing is minor, really, in the overall health picture, is it?
It's better to be safe than sorry. Just let somebody know. It may be something you can just treat, with a couple little simple measures, but it's best to be on the safe side. Not
to be sexist, but do we see different injuries for women than we do men in the sports that they play, basketball, soccer, whatever it may be?
Surprisingly, there are actually more ACL injuries, or anterior cruciate ligament, which is the main stabilizing structure in the knee. More ACL ligament injuries in females than in males.
Really?
Yep, because typically the mechanism is going to be a non-contact injury, and just anatomically females are different, and the muscles develop in different ways, and particularly in soccer and in basketball, you see a lot more ACL injuries in females than you do in males.
Will they heal quicker?
No, they heal about the same. I mean,
both male and female about the same?
About the same. They both, in young, active, healthy individuals, you're typically going to recommend surgery, and the healing time for males and females is the same.
We all know. I had a meniscus knee fixed a couple of summers ago, and I went through rehab, and guess what? When I got done with rehab, I was done. Should I have quit, or should I continue some kind of regiment? I jogged for a lot of years. I do treadmill and all of that. Then I went out one Saturday. I came back in. It just started swelling, and I said, uh-oh, something's wrong here. So then I had to go ahead. But my question is, after the initial rehab is over, I just quit, like most people do. Should I have continued?
I think a baseline exercise program is obviously very beneficial, even after you complete your rehabilitation from a particular injury, or even if you don't have an injury. Just some level of fitness, I think, is very important.
Well, for the most part, the Titans are in pretty good shape. As you know, football-wise, Dr. Glenn, the deeper you get into the season, the more bumps and the more bruises, and this, of course, is something I would guess, and we can talk to Lindell about this, as an athlete, especially at the pro level, and in college too, and you can speak to this, you just have to get your mind to a certain point, at the certain point of the season, to say, look, I'm going to hurt when I wake up tomorrow. Just get used to it.
Exactly.
Is that it?
That's exactly right. It's just a cumulative effect of all the practices, all the games, everything just takes its toll, and each week it just adds up.
Yep. Doc, I want to appreciate you being here. Thank you so much. We enjoyed it. We learned an awful lot.
Thank you.
Once again roll back the horizons of ignorance where we're concerned with orthopedic surgery. And the good Dr. Glenn, you go by and see him. He's at the Tennessee Orthopedic Alliance, and he was brought to us tonight by Baptist Sports Medicine. We're going to take a break. When we come back, Lindell White will be sitting right here. Thanks, Doc. We're back, everybody, right after this.
Titans Tuesday, brought to you by Baptist Sports Medicine.
It's time to put an end to living on the sideline. With joint replacement, the experts at St. Thomas Health Services can get armchair athletes into the game.
Honey, what are you doing? Please don't do this to me. Please
Life isn't a spectator sport, so jump back in. Visit sths.com.